Ataxia Telangiectasia, AT, is a rare genetic disorder characterized by progressive neurodegeneration, immune dysfunction, and an increased risk of cancer. Autosomal recessive inheritance is observed in AT, with both parents carrying one copy of the mutated ATM gene. In this script, we will delve into the molecular mechanisms underlying ATM gene dysfunction, clinical manifestations and progression, diagnostic techniques, neurological examination findings, immunological dysfunction, cancer predisposition, management and treatment approaches, prognosis, genetic counseling and family planning considerations, current research advancements, and the molecular and cellular mechanisms involved in the pathogenesis of AT. Let us now delve deeper into these topics. AT follows an autosomal recessive inheritance pattern, which means that both parents must carry one copy of the mutated ATM gene in order for their child to develop the disorder. The ATM gene is located on chromosome 11 and encodes a protein kinase involved in the repair of damaged DNA. Mutations in the ATM gene lead to impaired DNA repair mechanisms, which subsequently result in the accumulation of genetic abnormalities and the development of AT. Various types of mutations can disrupt the normal function of the ATM gene in AT. These include missense mutations, frameshift mutations, nonsense mutations, and large deletions or insertions. The resulting dysfunctional ATM protein fails to activate crucial DNA damage response pathways, leading to genomic instability and cellular dysfunction. Impaired DNA repair, cell cycle checkpoint regulation, and apoptosis contribute to the pathogenesis of AT. AT primarily affects the central nervous system, presenting with progressive cerebellar ataxia, which is characterized by impaired coordination and balance. Telangiectasias, dilated blood vessels on the skin and mucosal surfaces, are a characteristic feature of AT. Other clinical manifestations include oculomotor apraxia, immunodeficiency, increased susceptibility to infections, growth retardation, endocrine abnormalities, and an increased predisposition to various types of cancer. The progression of AT is variable, but most individuals experience a gradual deterioration in neurological and immunological function. Diagnosing it involves a combination of clinical evaluation, laboratory tests, and genetic studies. Clinical features, such as cerebellar ataxia, oculomotor apraxia, and telangiectasias, provide important clues. Laboratory investigations may reveal a decreased level of serum alpha-fetoprotein, which is a common finding in AT. Genetic testing plays a crucial role in confirming the diagnosis and identifying specific ATM gene mutations. Differential diagnosis includes other genetic disorders with similar clinical features, such as Friedreich's ataxia and Nijmegen breakage syndrome. Neurological examination in AT patients may reveal signs of cerebellar dysfunction, including dysmetria, dysarthria, intention tremors, and gait abnormalities. Oculomotor apraxia, characterized by difficulty in initiating voluntary movements, can also be observed. Other neurological findings may include chorioathetosis, dystonia, and pyramidal signs. It is important to perform a thorough neurological examination to assess disease progression and establish an appropriate management plan. AT patients exhibit varying degrees of immunodeficiency, primarily affecting the cellular arm of the immune system. There is a decrease in the number and function of T lymphocytes, leading to reduced cell-mediated immunity. Humoral immunity, mediated by B lymphocytes, may also be impaired, resulting in recurrent infections. Defects in antibody production and impaired immunoglobulin class switching contribute to the immunological dysfunction observed in AT. Individuals with AT have an increased susceptibility to cancer, particularly hematological malignancies and solid tumors. The defective DNA repair mechanisms in AT lead to the accumulation of DNA damage and genomic instability, which predisposes cells to malignant transformation. Leukemias, lymphomas, and breast cancer are some of the common malignancies associated with AT. Regular surveillance and early detection strategies are crucial in managing cancer risk in AT patients. There is currently no cure for AT, and management focuses on alleviating symptoms, optimizing quality of life, and preventing complications. Physiotherapy and occupational therapy play a vital role in managing motor deficits and enhancing functionality. Speech therapy can help improve speech and swallowing difficulties. Immunoglobulin replacement therapy may be considered to boost the immune system. Genetic counseling, psychological support, and palliative care services are essential components of the management approach. The prognosis of AT is variable and depends on the severity of the disease and the presence of associated complications. Most individuals with AT have a shortened life expectancy, with the majority succumbing to respiratory infections or cancer. However, with advances in supportive care and early intervention strategies, survival rates have improved, allowing individuals with AT to live into adulthood and beyond. Genetic counseling plays a pivotal role in families, as it helps individuals understand the genetics of the disease, determine the risk of having affected children, and make informed decisions about family planning. Carrier testing can be offered to individuals with a family history of it to assess their risk of being carriers. Prenatal testing and pre-implantation genetic diagnosis may be available to couples considering having children. Research efforts aimed at understanding the molecular and cellular mechanisms underlying pathogenesis are ongoing. Novel therapeutic approaches such as gene therapy, small molecule drugs targeting specific pathways, and stem cell-based therapies are being explored. Advances in genome sequencing technologies and functional genomics are contributing to the identification of potential therapeutic targets and the development of personalized treatment strategies. The molecular and cellular mechanisms underlying pathogenesis involve defective DNA damage response pathways, impaired DNA repair, and genomic instability. Dysfunction of the ATM protein compromises cell cycle regulation, apoptosis, chromatin remodeling, and telomere maintenance. Altered signaling pathways, including those involved in oxidative stress, inflammation, and immune responses, contribute to the complex pathophysiology of AT. In conclusion, AT is a multifaceted disorder that affects various systems of the body. Understanding the molecular mechanisms, clinical manifestations, diagnostic techniques, management approaches, and ongoing research advancements provides valuable insights into the complexities of AT. As medical professionals, it is crucial to stay up to date with the latest developments in the field to provide optimal care and support for individuals with AT and their families.